everyone, this video will discuss the initial physio outpatients appointment after a total knee replacement. My name is Francesca Peplow and I'm from the Physio Matters team. There will be 3 segments. So the first section is subjective questions and key responses to look out for. The second section is red flag questions and things to check. 3 is the objective assessment. So our subjective questions. So there's some really key questions we need to focus on during this first assessment, including what pain symptoms does the patient have and what pain management strategies are they currently using. This can give us an idea of how much they might tolerate in this physio session and how well they're tolerating, mobilising and getting on after their operation as a whole. Additionally, we want to know how are they managing any swelling. Has the patient been provided with information on swelling management strategies or do they need some guidance from that from us? Information on how they're mobilising at the moment, indoors at home as well as outdoors, can give important clues on how well this patient is progressing, what we might manage in this session, and we also want to know if they're currently following a home exercise programme. They may have been given one by inpatient physios, but they may not have done. We also want to know, are they finding this programme manageable and are they following it consistently? And if they're not, why are they not? Finally, does the patient have any written or verbal post-operative precautions or instructions that will inform our assessment and management going forward? The second section is our red flag questions. This is mainly to screen for any post-operative complications in this group. At this point, it's worth checking whether there were any intraoperative complications, as that might give us an idea that recovery could be delayed or this might be a bit more complex than we first thought. Additionally, has there been a sudden increase in pain, new swelling, increased redness around the calf? We want to ensure that this patient hasn't developed a DVT. We also want to know, have they had a DVT in the past, as it might make our threshold for concern a bit sort of lower. We also want to rule out signs of infection. Feverish symptoms, seeping of the wound, increased swelling around that knee would all be concerning signs. And then we move towards our objective assessment. So firstly, look at the surgical wound. Are there any signs of infection, discharge, expanding redness beyond the edges of that wound, or unusual heat in the area are all indications of an infection that would warrant an immediate, urgent medical opinion and signposting your patient to another service. At this point, you also might want to measure the circumference of that knee so you can track this swelling objectively from session to session. So next, we want to look for signs of a DVT. Do their calves feel and look the same? Is there any redness, unusual swelling or a positive Homan sign? Additionally, are those pedal pulses equal? We really need to ensure that the blood flow is not interrupted to the lower limbs and the feet. And at this point, it's a good time to safety net the patients for signs of DVT and infection. So next, we look at range of motion. We don't eyeball, we measure. How much flexion and extension does this knee have? Has the contralateral limb had a joint replacement previously or not? So we want to compare right to left and understand what normal is for this patient and what we're aiming for. So don't forget, you need active and passive range because both pain and muscle strength can be inhibitors of range. So patients often focus on increasing flexion, but they often forget about knee extension. So good communication of the importance of full extension in this first session is really important. Strength is important in the rehabilitation of a total knee replacement, particularly quads activation. So in this early stage, can patients activate their quads in a static position? And if they can they perform in a range quads or a straight leg raise? So that gives us a good indication of that base level we're starting with at the beginning of our management. Finally, have a look at their gait. Are they ready to progress to one crutch or mobilise independently? Not all patients will progress at the same rate, so also don't forget to consider where their mobility baseline was prior to surgery. Think about what you're aiming to get back to. And to finish off your session, ensure the patient has a chance to ask you any questions or share any concerns that they have. This helps establish good communication between the patient and the physio and ensures you're singing from the same hymn sheet from day one.